The impact of AI on mental health diagnosis, revolutionizing early detection and personalized care. Mental health issues are more prevalent today than ever before, affecting millions of people globally. Despite growing awareness, timely and accurate diagnosis remains a significant challenge. Traditional mental health diagnosis often relies on self-reporting and subjective clinical judgment, which can lead to misdiagnosis or delayed treatment. However, the emergence of artificial intelligence, AI, is opening new doors in the realm of mental health care, bringing innovation, speed, and precision to the diagnostic process. Understanding the mental health diagnosis challenge. Mental health conditions like depression, anxiety, bipolar disorder, and schizophrenia are complex and often present with overlapping symptoms. Diagnosis traditionally depends on patient self-reporting, which may be influenced by stigma, memory gaps, or communication difficulties. Clinical interviews, where even skilled professionals can miss subtle indicators. Limited access to specialists, especially in remote or underserved regions. These challenges contribute to underdiagnosis or misdiagnosis, resulting in delayed care or ineffective treatment plans. How AI is transforming mental health diagnosis. Artificial intelligence has the potential to enhance mental health diagnosis in several groundbreaking ways. 1. Early detection through pattern recognition. AI can process vast amounts of data from speech patterns, facial expressions, social media behavior, wearable devices, and more. Algorithms trained on large datasets can detect early signs of depression, anxiety, or PTSD, sometimes before individuals even realize they're struggling. For example, voice analysis tools can detect monotony, slower speech, or tone shifts associated with depression. Facial recognition AI can identify micro-expressions indicating emotional distress. Text analysis of social media posts or written journals can flag negative sentiment or hopelessness. 2. Increased diagnostic accuracy. AI systems trained on diverse mental health case data can identify complex patterns that might be missed in human evaluations. These models offer consistent and unbiased insights, reducing the subjectivity of traditional diagnosis. Some platforms even integrate multiple data sources, biological, behavioral, cognitive, and environmental, for a more holistic view of the patient's mental state. 3. Remote mental health assessment. Telemedicine and digital health platforms are on the rise. AI tools can enable mental health assessments through smartphones, chatbots, or online surveys, making diagnosis more accessible, especially in areas with few mental health professionals. Virtual assistants powered by AI can also screen users for symptoms and provide recommendations for further evaluation or care. 4. Personalized treatment recommendations. AI doesn't stop at diagnosis. Once a condition is identified, AI can analyze what types of therapy, medications, or lifestyle interventions have worked best for people with similar profiles. This helps create tailored treatment plans that are more likely to be effective and sustainable. Challenges and ethical considerations. While AI brings significant promise, there are important challenges to consider. Privacy concerns. Sensitive mental health data must be protected from misuse or breaches. Algorithmic bias. AI must be trained on diverse datasets to avoid reinforcing stereotypes or excluding minority populations. Lack of human empathy. AI can assist, but it cannot replace the therapeutic relationship between a patient and a trained professional. Regulation, transparency, and human oversight are essential to ensure AI tools are used responsibly. The future of AI in mental health care. As technology advances, AI will likely become a standard companion in mental health care. Combined with human expertise, it can reduce the burden on overworked professionals, improve mental health screening in schools, workplaces, and communities, help track patient progress over time through continuous monitoring, reduce the stigma by making support more accessible and non-judgmental. Conclusion: AI is not here to replace therapists, counselors, or psychiatrists, but to empower them. By enhancing diagnostic accuracy, enabling earlier intervention, and understanding the challenge in mental health diagnosis. Mental health disorders often present invisibly and can be difficult to detect in their early stages. Diagnoses typically rely on self-reported symptoms, which can be inaccurate or withheld due to stigma, observational assessments by clinicians, questionnaires, and behavioral interviews. This method is prone to human error, cultural bias, and variability in interpretation. Many people may also avoid seeking help due to the social stigma surrounding mental illness, leading to undiagnosed or misdiagnosed cases. Robot: How AI is transforming mental health diagnosis. 1. Early detection through data analysis. AI tools can analyze digital footprints like text, speech, and biometric data to detect early warning signs. Natural language processing, NLP, analyzes text and messages, emails, or journal entries to spot signs of depression, anxiety, or even suicidal ideation. Voice and speech patterns. AI detects changes in tone, pitch, and speed of speech that may correlate with mood disorders. Facial recognition. Some tools monitor micro-expressions to detect emotional states in real time. 2. Chatbots and virtual therapists. AI-driven chatbots such as Wobot, Wysa, and Tess simulate conversations and provide emotional support 24/7. While not replacements for therapists, they help users reflect on emotions. Practice cognitive behavioral techniques. Monitor mood daily. These tools can bridge the gap between recognizing symptoms and seeking professional help. 3. Machine learning for diagnosis support. Machine learning models trained on large clinical datasets can compare a patient's symptoms with thousands of previous cases, predict likelihood of specific conditions, recommend next steps for further evaluation or referral. 4. Wearables and real-time monitoring. AI-integrated wearables like smartwatches and biosensors can track sleep patterns, heart rate variability, physical activity levels. These biometrics are often linked with mental health status. By combining data, AI systems can alert users or clinicians about potential issues before symptoms worsen. Women health worker benefits for clinicians and patients. For clinicians, decision support tools that aid in making more accurate diagnoses. Ability to prioritize high-risk patients. Reduced burden from manual assessments and paperwork. For patients, faster and more accurate diagnosis. Lower cost preliminary screening tools. 24/7 support via apps and chatbots. Greater access in rural or underserved areas. Globe real-world applications. Mental health apps. Apps like Youper, Ginger, and Replica use AI to support mental well-being through interactive chats, journaling, and personalized suggestions. Suicide prevention. Social media platforms, such as Facebook, use AI to scan posts and comments for suicide-related content and alert emergency responders or friends. Telepsychiatry integration. Platforms like Talkspace and BetterHelp increasingly incorporate AI for matching patients with the right therapist and optimizing session outcomes. Balance scale ethical and social considerations. Data privacy. Sensitive health data must be protected. AI tools should comply with laws like HIPAA or GDPR, and users must be informed about how their data is used. Bias and fairness. AI must be trained on diverse datasets to avoid misdiagnosis, especially among marginalized communities. Transparency. It should be clear when an AI tool is being used and how it arrives at its conclusions. Human oversight. AI should support, not replace, human clinicians. Final decisions should always involve trained mental health professionals. Rocket the future of AI in mental health. AI's future role in mental health is vast and still evolving. Key trends include personalized AI therapy companions, augmented reality and virtual reality therapy, predictive analytics for mental health crises, global reach in low-resource areas using AI apps.